What are the types of hysterectomy for cervical cancer? When it comes to treating cervical cancer, one of the key surgical options is a hysterectomy, which involves the removal of the uterus. The type of hysterectomy performed can vary based on the stage of cancer and how far it has spread. Let's explore the main types of hysterectomy used for cervical cancer treatment. First, we have the simple or total hysterectomy. This procedure removes both the uterus and the cervix. In some cases, the fallopian tubes may also be taken out, but the ovaries are usually left in place to help avoid early menopause. This type of surgery is often used for very early cervical cancer or severe precancerous conditions. It can be done through different methods, such as an abdominal incision, vaginally, or using laparoscopic techniques, which may include robotic assistance. Next is the radical hysterectomy. This is a more extensive surgery that removes the uterus, cervix, the upper part of the vagina, and the surrounding connective tissues. Depending on how far the cancer has spread, the ovaries, fallopian tubes, and nearby lymph nodes may also be removed. This type of hysterectomy is typically recommended for invasive cervical cancer that has extended beyond the cervix but has not spread widely. The goal here is to remove all cancerous tissue and minimize the risk of recurrence. Then we have the modified radical hysterectomy. This surgery also removes the uterus, cervix, and upper vagina, but it does so to a lesser extent than a full radical hysterectomy. This approach aims to balance the need to treat the cancer while preserving more of the normal anatomy. Similar to the radical hysterectomy, it may involve the removal of lymph nodes and sometimes the ovaries. Lastly, there is the supracervical or partial hysterectomy. This type removes only the upper part of the uterus while leaving the cervix intact. However, it is less commonly used for cervical cancer treatment since the cervix is where the cancer typically originates. In addition to these types of hysterectomy, lymph node removal is often performed alongside radical or modified radical hysterectomy to check for any cancer spread. The choice of which type of hysterectomy to perform depends on several factors, including the stage of cancer, tumor size, the specific type of cancer, the patient's overall health, and fertility considerations. The surgical approach chosen, whether abdominal, vaginal, laparoscopic, or robotic, is based on the characteristics of the tumor and the expertise of the surgeon. Ultimately, the main types of hysterectomy for cervical cancer are simple, radical, and modified radical, with each tailored to the specific needs of the patient and the cancer's progression. It is crucial for patients to discuss their options with a gynecologic oncologist to determine the best course of action for their individual situation.